September is National Prostate Cancer Awareness Month, and of course, THV11 is all about conquering cancer however possible. All new this morning, you'll meet a local pilot who says he could have easily become a statistic if it wasn't for a routine checkup. Brian Erb has a lot to live for, a career pilot, husband, and father. Learning a potentially deadly disease had invaded his body was not on his radar after his yearly physical.
I had zero symptoms of anything when this happened, so it was really kind of a shock when I heard that I might have prostate cancer.
Brian's family doctor had ordered a prostate screening PSA test as part of his blood work, something not all doctors do anymore.
Then a few days later, you get a call saying, hey, it looks like your PSA levels have increased since last year when we tested it.
Brian's case eventually landed with surgeon Dr. Tim Langford, chairman of the urology department of the UAMS Winthrop P. Rockefeller Cancer Institute. Dr. Langford says while not all family physicians elect to do the PSA screening, in Brian's case, it caught an aggressive cancer before symptoms even started to show.
That's the one message I could tell men, and Brian's probably 50, in midlife, to get a midlife baseline PSA, because if it is 1 or less, it virtually eliminates the risk of aggressive prostate cancer for the next 20 years, to be honest. You don't have to get yearly screening.
In Arkansas, prostate cancer is at the top of the 10 most prevalent new cases of cancer for 2020, according to the CDC. It's the second leading cause of cancer deaths for the same year behind lung disease. Dr. Langford says it's commonly known that men tend to put off screenings partly to avoid the need for a biopsy and the side effects that can come with it. But he says diagnostic tools are much better these days.
The problem we've had in the past is millions of men have prostate biopsies, 75% of them are benign. Now we have tests, the biomarkers and MRIs, that can maybe weed out the patients who will have a benign biopsy and really focus on the ones who may have an aggressive cancer.
Brian's cancer turned out to be one of those types. Even then, though, he says the decision for treatment felt better than just watching and waiting.
Overnight, only one night in the hospital. Within a couple of days, I am walking a few miles, still. So it's walking slow, but I was walking. So it was a pretty painless, all in all process.
He says the FAA automatically grounds a pilot with a medical condition like his. Now that the treatment is over, he says his view of the future looks as bright as it does 30,000 feet above the ground.